Hey everyone, what's up? It's Dr. Charlie here. Wanted to shoot a video today to share with you 4 tips and or ways that you can potentially get out of bed with less pain if you have some type of back, butt, or sciatica pain. So I had a viewer of mine reach out the other day and said, hey, is it possible you could shoot a video because my mom's having some back problems and her pain is worse first thing in the morning, which is very common, by the way, for people with back issues, and she's really struggling to get out of bed. So I want to share with you some tips, some ways you can tweak the way that you get out of bed to find more comfort first thing in the morning. And real quick, if you are not sure of the cause of your back pain, butt pain, and or sciatica pain, check out my DIY diagnostic guide. You can download it for free by clicking the link above and or check out the link in the descriptions. Inside of this guide, I share with you all of my frameworks as far as step-by-step how I would go about figuring out the most likely source of your symptoms. So the first technique that I want to go through is something that I would call a heel slide log roll. All right, so this works really well if you're starting from your back. And basically it allows you to get up, again, with less pain if you have some type of back pain or stiffness first thing in the morning. So starting from your back, what you want to do is you want to slide your heels up, but you're going to do one at a time. So it doesn't really matter which one, but you slide your heels up, all right? Slide, the slide. Notice I'm emphasizing the slide. Because if you don't do the slide, here's what happens. So she just slid her legs up one at a time. Let's pretend she didn't do that yet. Here's what a lot of people do when they have back problems first thing in the morning. Go ahead and lift your legs up. Ugh. Yeah. Notice how it puts a lot of load. You probably even saw her back arch a little bit, right? When you lift your legs up. Hold your legs there. Hold them, hold them. Right? It causes this arch in your lower back. It just loads the abdominals and puts a little bit more compressive strength throughout the belly and the back itself. So instead of lifting your legs by activating the muscles in your belly and your hips, your hip flexors, what I would ask that you try is slide, heel slide. This activates your hamstrings and allows your hamstrings to pull your leg up instead of your hip flexors. So kind of little trick to shut off, so to speak, not actually, but to reduce the amount of effort through the hip flexors or the front of the body first thing in the morning. So you slid one leg up, you slid the other leg up. So now you've got the heel slide portion of things done. Now you're going to perform a log roll. So what you're going to do this is you've got your arms and your legs. And because A, last time I checked, comes before L, you're going to use your arm first to help guide the roll or direct the roll, and then you're going to follow with your legs. All right, so she slid her heels up. Now she's going to reach with her arm and let her legs naturally follow and fall. Okay, so now she's in this position. And then she is going to use this hand, right where it is actually, to push up as she lets her legs fall off. Push up. Perfect. So that is heel slide, log roll. So now let's go through it full speed, full circle. Ready?
You can make me do it with my memory.
With your memory?
Yeah, like.
There was only a few steps. Yes, I'm going to make you do it with your memory. Step 1. What is step 1?
Slide up one leg at a time.
Slide your heels. Yep. Boom, boom. Great. Okay, what's next?
I have to reach.
A before L,
I have
right?
to reach.
Reach with your arms, let your legs follow. Yep. Now what are you going to do?
Now I gotta push up and let these fall down. Okay, yeah, that's good.
Woohoo! Good job. Okay, so that is the heel slide log roll. There's just a few steps there, so if you can remember a few things, you should be good to go. All right, so the next technique is what I would call a walk-off technique, all right? So you have to have a little bit of height to your bed to do this. If you're sleeping on the floor, well, I guess it could work, but it's not going to work that well. So let's just say that you found that kind of sleeping in this little figure 4 frog leg position, or kind of like semi-side sleeping, yet sort of on your belly, works best for you, and that's how you wake up. Well, then this is a technique that might work for you. So what you want to do is you want to walk off the bed. So what a lot of people would do with back pain is, I don't know, what would you do to get off the bed? How would you get off this bed if this were a real bed? Exactly, good. Lay back down. Okay. That was great. So notice she went through a lot of steps, right? So she pulled both legs up, right? Bent her back, and then she kind of used her muscles in her back to push on up, along with her arms, of course, okay? But there's maybe an easier way. So instead of doing all of that, what you could do is you could walk off. So what I would ask that you do is take this leg, scoot yourself a little bit, drop this leg off. Okay, hold on. Put your arms in front of you, almost like you're going to do a push-up. on the bed. All right. Now, as you eventually walk this leg off, you're going to keep your back straight and kind of use your arms to push up and off.
Okay.
You think you can try it? Let's see what we can do with just that instruction. All right, so you're going to drop this off, push up, push up, push up, push up. Okay, not terrible, but I think we can do better. So she's still pretty bent there. So ideally, come back on the table.
You didn't let me practice before this.
This is unscripted.
Yeah.
All right, so let's do it again this time. All right, so drop that leg off. Push up with your arms starting right now. Hands, yep. Push up, push up, push up. Perfect, now drop that leg off. Okay, a little bit better. Can you do it again? Well, it's not good nor bad. So that's the cool thing. She asked a good question. What's not good? There's not a good and a bad. It's just whatever feels comfy. And so I'm trying to have you keep your back straight.
Okay.
So that you kind of get off and you get up like a board, right? Okay. In that, I don't want you to be super rigid, but I want you to just try to keep everything aligned, if you will.
Okay.
All right? Go ahead. So this way you're not flexing your spine a lot. You're not extending your spine a lot. Perfect.
You need to give that instruction.
Sorry, I should see. So we'll do better next time. All right? So that's it. So that is a walk-off technique. So it was actually probably good for you to see because you could see that I didn't instruct her very clearly to begin with, right? And she asked some good questions and we figured it out. So hopefully that was useful. But again, useful if you're semi-side sleeping or flat on the belly. And you notice, especially at rounding the back, first thing in the morning is problematic. Maybe you have trouble bending over, putting on shoes, slippers, feeding the cat, dog, whatever it is first thing, right? And you're sensitive to that back round, you can simply just walk off the table and keep things more neutral. All right, so that is the second technique. Now the third technique is a little bit different and or outside the box. It actually has nothing to do with motion. You could combine this technique with either of these techniques or even one that you find for yourself, but it would be something we call visualization, all right? So there's something we call predictive coding. Predictive coding is this idea of like, hey, I've gotten out of bed so many mornings, Charlie, and my back is hurt every time, and so therefore, even when I think about getting up in the morning, it triggers my pain, and or I'm already telling myself, the morning's gonna be the worst, like I hate getting out of bed. So imagine this. Your child is going to take a test, or you are going to take a test. Maybe you don't have a child, right? And you tell yourself, or your child, you're going to fail, or I'm going to fail. And you do that over and over and over again. Well, probably, I don't know. I'm sure there's some type of study that's proven this, but chances are you're probably going to fail, right? So that which you believe becomes the reality. So in this case, if you were laying there and you're getting ready to get out of bed and you're telling yourself, this is going to be terrible, and you've told yourself this for weeks or for months or for years, well then it's probably going to be terrible. All right, so you want to be careful to sort of guard the mind. And so what you can do is you can visualize yourself getting out of bed. Maybe you're using one of these techniques or not, but you can start practicing visualizing yourself getting out of bed pain-free. And what you really need to focus on is the feeling of what it would feel like to get out of bed pain-free. So visualize yourself getting out of bed, feeling happy, and like, wow, this is really cool. It feels great to be able to do that. A little bit of a trick, a little bit of a hack, maybe not super exciting because she's just laying here staring at the ceiling. All right, so there's not really a whole lot to be done physically there, but you might want to consider how your beliefs and or how your thoughts about how bad or how good getting out of bed will be potentially impact the pain that you experience while you're doing that activity. So the final technique you may want to consider is this idea of using movement as medicine. And what I mean is that you can use motions that feel good and feel safe and reduce your pain and time them right before you get out of bed. So if when you're lying down you feel okay, but then when you go to move or sit up or stand up you feel pain, then you want to ask yourself, what is a motion I could potentially do in bed that feels safe and feels good that could improve my ability to move and walk and get going first thing in the morning, could lessen my pain getting out of bed. And we're not going to go into this at the moment just because there's many different options. Maybe there's a follow-up video here, so just some foreshadowing as to what you might see in the next video. Potentially I'll walk you through a few different movement options that you might want to explore. But start to ask yourself, how can I get creative with different exercises and movements and start to explore different ways of moving my body in bed while I'm laying there immediately before I get out of bed? And can I start testing these things scientifically one at a time to find a motion that helps me? And that is the idea behind using movement as medicine. Lots of people think of using exercise and motion to reduce their pain, but most people do not time it appropriately. And here's what I mean. If you had, let's just say, a headache, all right, at 2 p.m. in the afternoon, and you had a pill, a headache pill that you knew would reduce that headache at 2 p.m., when would you take it? Would you take it at 8 in the morning? Would you take it at 1:45, 15 minutes before? Would you take it at 3 o'clock or 6 o'clock in the afternoon or the evening? The answer is probably obvious. Charlie, I'd take it at 1:45. It makes most sense. If I take it at 8 in the morning, it's probably going to wear off by then. Exactly. So you think about the timing of a traditional medication, but many people don't think about the timing of their movement. So if you have a sheet of exercises that you're doing right now because the PT gave them to you, or maybe you're trying some stuff on YouTube or whatever it is, you might just be doing them whenever is most feasible and or whenever is most convenient. Or maybe you're not even thinking about when you're doing them, you're just doing them randomly. And so I would challenge you to take those movements, if you found any that worked. If you haven't, well, let me know in the comments. We can chat about that. But you want to take those movements and you want to use them as medicine. Bottle them up and do them in bed. Take the ones that you do lying down and do them right before you get out of bed in the morning, and not all of them, one at a time. See which ones work, or maybe none of them work, to improve your ability to get up and get out of bed, and obviously allow you to do so with less pain. So those are the 4 techniques. So just to summarize, heel slides, sliding the legs up or bending the legs up through sliding the heels on the bed, and then reaching with your arms, letting your legs follow, right? Letting your legs drop and pushing up. A little bit of a robotic way to get out, but definitely involves a little bit less twisting and flexing of the spine, and often reduces back pain getting up first thing in the morning. So that's the first technique. Second one was the walk off. So if you're kind of this wonky side sleeper and or someone who prefers a little bit more like side to belly sleeping, then you can easily just walk off the bed rather than doing what you saw earlier, which is people start on their belly and then they like kind of bend over and do all this funky stuff. Just drop your leg off, use your arms to walk off and push up and get going. That is the second technique. Third one was visualization. Be aware of this idea of predictive coding, already calling the shots and or telling yourself how you're going to feel before you actually do it. So if you have lots of repetition or practice of thinking and feeling that getting up out of bed is going to be terrible, getting up out of bed is going to be terrible, and this is going to hurt, well then you're probably right. And so you just continue to reinforce that not only belief, but then you make it happen, right? And you confirm, yep, see, getting out of bed was terrible, and you deepen that belief. There's more conviction behind it with more reinforcement. So visualize yourself getting out of bed pain-free, and really not just getting out of bed pain-free, but how would it feel, right? And enroll yourself in that feeling of like, wow, that was really cool. I was able to do that. I haven't done that in a long time. And so feel what that feels like, all right? Fourth and final tip or technique, use movement as medicine. So take something you're doing right now, whether it be an exercise that you're doing with PT and or off of YouTube or something like that, it's got to feel good, and time it appropriately. Find something ideally that's laying down, right? And or maybe something that's even sitting on the edge of the bed, and do it. And see if that improves your ability to just transition out of bed and get on with your day a little bit better. All right, so that's it for this video. Be sure to let me know your thoughts in the comments, any questions or anything like that. Also, let me know, would you be interested in seeing a follow-up video that walks you through some specific morning routines and or motions you could potentially try? Be sure to hit the subscribe button as well as the bell for notifications when we go live every single week. Also hit the thumbs up. And that's all we got. Until next time, chat soon.